Women and Heart Disease, Myth versus Fact is presented by Dr. Dalton Miranda, a cardiologist with McLaren, Northern Michigan, one of the nation's top 50 cardiovascular hospitals for 4 years running. Dr. Miranda busts common myths about women and heart disease.
So we're going to start with some myths and facts because there's a lot of that in regards to heart disease in women. Okay? So the first one is that heart disease doesn't affect women and that the real threat is cancer. Of course, I'm not here to tell you that cancer is not important, and it's important to do all your screening and be careful with all types of cancers. I'm not saying that, but the heart disease is a killer, and it's the biggest killer for women, okay, particularly in older women. So it's a killer that strikes more women than men. It's more deadly than all forms of cancer combined. And we're talking about cardiovascular disease. I'm going to actually make that clarification right in the beginning, because cardiovascular disease is lumped as one thing because it affects two main different organs, which is the heart and the brain with the stroke, but it's all very together, okay? Because the pathophysiology of it, how the disease progresses, starts and progresses, is very much similar. So heart disease is a killer that strikes more women than men. It's more deadly than all forms of cancer combined. While 1 in 31 American women dies from breast cancer each year, heart disease claims the lives of 1 in 3. Okay? That's roughly 1 death in each minute. So you can see the degree in which heart disease affects women, and there's a lot of time this disconnect between the concern with cancer and the lack of concern with heart disease, even though this is what the fact is. Heart disease is for old people, so heart disease affects women of all ages. For younger women, the combination of birth control pills and smoking boosts heart disease risk by 20%. And while the risks do increase with age, things like overeating and a sedentary lifestyle can cause plaque to accumulate and lead to clogged arteries later in life. But even if you lead a completely healthy lifestyle, being born with an underlying heart condition can be a risk factor. The youngest woman that I have recall in my practice that I saw coming in with a heart attack was 32 years of age. Okay, and it took us all night to understand that she was having chest pain. She was having a heart attack, because the first thing that comes to mind is not a heart attack, especially in such a young woman. But it happens, okay? And we can't close our eyes to that. We need to understand. It does increase with age, don't get me wrong. Heart disease increases for men and women with age, but it doesn't only affect people that are older, okay? Heart disease doesn't affect women who are fit, okay? So even if you're a yoga-loving, marathon-running, workout person, your risk for heart disease isn't completely eliminated. Cholesterol eating habits, smoking can counterbalance some healthy habits. You can be thin and still have high cholesterol, mostly when it's familial, which is a big percentage of patients. And the American Heart Association, the AHA, recommends you start getting your cholesterol checked at 20 or earlier if you have a family history of heart disease. And while you're at it, be sure to keep an eye on your blood pressure in your next checkup. So I wish that you would say everybody who exercises and everybody who keeps a good weight are free of heart disease. Unfortunately, those are just two pieces of the puzzle, okay? And we're going to talk about that, all the risk factors that bring to heart disease. And of course, that is important, but it's not the only thing. So being fit and not being overweight and being relatively active, unfortunately, doesn't rule out that heart disease can start and progress. I don't have any symptoms. That is a common one, a very, very common one for women. We're talking about, of course, specifically for women. So 64% of women who die suddenly of coronary disease have no previous symptoms. Because the symptoms vary greatly between men and women, they're often misunderstood. The media has conditioned us to believe that the heart attack is extreme chest pain, that the typical crushing in the chest and I can't breathe. Well, unfortunately, that's not always how it works. If you were, it would be easy, but it's not always this way. Women are somewhat more likely to experience other symptoms other than chest pain as a sign of a heart attack. shortness of breath, nausea, vomiting, back pain or jaw pain. Very commonly, they will have what we call an inferior wall heart attack, which affects the lower portion of the heart on the left side, and that comes with heartburn, okay, a feeling of nausea and vomiting, just not feeling well, fatigued, and a lot of times this is misinterpreted as something else other than a heart attack, and women have a tendency to show up later to the hospital when sometimes we say in cardiology that the time is muscle, so the longer you take to seek medical attention, the more likely you are to lose some muscle, some function of the heart. So unfortunately, women a lot of times stay home thinking that it's something else. Heart disease runs in my family, so there's nothing I can do about it. So this is kind of the opposite of the other one, right? Well, because I'm going to have it anyway, so there's nothing I can do it. Of course, that's not true. Although women with a history of heart disease are at a higher risk, there's plenty you can do to dramatically reduce it. You just have to get at it, and we're going to be talking about what needs to be done. Okay? Because of healthy choices and knowing the signs, more than 600,000 women have been saved from heart disease, and 330 fewer are dying every day. So we basically just need to know what to do.
Talk to your primary care provider today about a referral to a McLaren Northern Michigan heart specialist, or visit mclaren.org/Northern Heart. Video funded through the Bruce A. and Linda E. Riley Health Lecture Series Fund.